We're going to look at chapter 10, the respiratory system. A little bit overview. The respiratory system is going to bring in O2 as air is inhaled into the lungs and passes oxygen into blood. It rids the body of CO2, carbon dioxide, through exhalation as the lungs receive CO2 diffused out of the blood. The basic job is to make sure oxygen requirements are met. Carbon dioxide is a byproduct of cellular metabolism, and it does play a role in the exchange of oxygen for carbon dioxide. When we look at referring to the exchange of air between the lungs and the atmosphere, it's called respiration. So breathing or ventilation would be equivalent to that. So it's exchange of gases within the body, and to take in air and exhale air. We also divide it into upper respiratory and lower respiratory tract, and it's going to supply oxygen to the body cells and tissue via the bloodstream, and it's needed and required to maintain life. Alveoli or alveolus are little air sacs. The alveoli are at the end of the coming down the trachea into the lungs, or the bronchi, the bronchioles, and then alveoli are at the end. We need those to open to maintain proper airway. Broncho and bronchio are the airway, little like branches look like tree trunks. So bronchoscope would be looking at those. And then bronchiocele would be like a saccular bronchiole. Bronchiole, the bronchioles, it's a littler airway. So the smaller ones coming off of the tree. So bronchiolitis, so inflammation of the bronchioles, often seen with like asthma. Capno or carbo is carbon dioxide, so hypercapnia. So we have an increase of it. Hypocarbia would be a decrease. Laryngeal, the larynx is the voice box, so laryngospasm is the spasm of that. Lobo is a portion, so lobectomy would be removal of one of the lobes of the lung. Your right lung has 3 lobes, your left lung has 2. Naso would be referring to the nose as well as rhino. So if you have a runny nose, rhinorrhea. Oro is the mouth, so oropharyngeal, is pertaining to the mouth and the pharynx. Oxo is oxygen. Hypoxemia, so hypo meaning low, and emia is the blood. So you have little oxygen in your blood. Palato, palate, palatoplasty, so going to be a repair of the palate. Pharynx, pharyngitis, inflammation. Phren is the diaphragm, also mind. So phrenospasm is a spasm of the diaphragm. Pleuro is the pleura or pleurisy, the sac around the lungs. Pneumo or pneumono is a air or lung, so pneumonia. So this is pertaining to the lung, and so often you'll see pneumonia, but there needs to be something behind it. So there's an aspiration pneumonia, bacterial pneumonia, what type of pneumonia. Pneumonectomy is to actually remove a lung. Pulmono is also lung. So pulmonologist is the doctor that studies the respiratory system or the lungs. Sinuso is the sinus cavity, so sinusitis, inflammation of. Spirometry is breathing. So this is a measurement that we do to inhale and exhale. Take deep breaths in. On the inside of spirometer was a picture of. Thoraco, pectoro, stetho are all chest. So thoracotomy, making an incision. Pectoralgy, pain, and stethoscope, where we're going to measure, listen. Tonsillo is a tonsil, almond-shaped little guys. Inflammation of the tonsils, tonsillitis is common, especially in childhood. So they might have a tonsillectomy to remove them. Tracheostomy, trachea is the windpipe. So cutting into would be tracheostomy. They would have a hole in their trachea. Uvula, the thing that hangs down the back of your throat. You can have uvulatis, so it gets inflamed. Apnea, so whatever, like dyspnea. So the P is kind of accentuated when you put the prefix instead of it. So bradypnea, so dyspnea would be difficulty breathing. Bradypnea or tachypnea would be fast and slow. Often could be difficult to accentuate or to say. It's kind of hard sometimes with the P to include that. So eupnea, these are some of the breathing that we have as normal breathing or good breathing. Bradypnea, slow breathing. Tachypnea, fast breathing. Hypopnea, shallow breathing. Hyperpnea, deep breathing. Dyspnea, difficulty breathing. Apnea is no breath or inability. Orthopnea is what we refer to somebody has difficulty breathing, so they can only breathe in an upright position. Ortho means straight. And chain stoking is where there's a different pattern where you have a gradual increase of depth and sometimes the rate followed by a period of apnea. So it's abnormal breathing that we sometimes see in somebody that's dying. So these are kind of just, we don't measure this as far as like a EKG, how we measure the heart, but this would be how inspiration and expiration would be normal versus slower, faster. So it does kind of resemble what we measure. We just don't measure that in a clinical setting. When we listen to lungs with our stethoscope, it's called auscultating the lungs, and we listen to a normal exchange of air, but sometimes we hear what we call adventitious sounds. So when we hear crackles, it's a popping sound caused by the air entering those little sacs at the end, the alveoli. Wheezes is high-pitched musical sounds that's caused by a narrowing, so that airway sometimes gets inflamed, and so the air going through it causes a wheezing. So we hear that a lot with like asthmatics. And a stridor would be an even higher pitch one of that, like a crowing, and that's due to an even narrower airway. So we often hear wheezes go to stridor if it's not relieved, and then go to silent because there's no air exchange and somebody can die. Diminished is a distant flow of air. There's not enough kind of getting through there. Absent is no air exchanged. We also can have rhonchi, which is kind of a musical pitch with inhaling and exhaling. It's kind of combined with crackles. And then caseous necrosis is a degeneration and death of tissue with has a cheese-like appearance. So caseous kind of means cheese-like. Cyanosis, blue. If you have a blue coloration of the skin, cyanosis, it's a deficit of oxygenation. Dysphonia is hoarseness. So phono is voice or sound. And dys meaning abnormal. Epistaxis is a nosebleed. Epi is upon. Staso is to drip. So epistaxis is a nosebleed. Expectoration is coughing up and spitting up material, so like sputum, which is the stuff that comes out, where hemoptysis is where you are spitting up and blood is in there. So spitting up blood is hemoptysis. Hypercapnia, hypercarbia is both excessive levels of carbon dioxide. Hypoventilation is where somebody has deficit movement in and out of the lungs, where hyperventilation is too fast or excessive movement out of the lungs. Hypocapnia, hypocarbia would be decreased carbon dioxide in the blood. Hypoxemia is deficient oxygen in the blood versus hypoxia is deficient oxygen in the tissue cells. Obstructive lung disorder, that means something's blocking the flow of air moving in and out of the lungs. And restrictive is a condition limiting the intake of air in and out of the lungs. We see that with a lot of smokers, or what we call chronic obstructive pulmonary disease. It's obstructive, but then it's also restrictive as well. They don't have the strength that the lungs get scarred. Pulmonary edema is fluid fills the spaces around the alveoli and floods them. A pulmonary infiltrate is on an x-ray, you can see a density or consolidation of matter within the air spaces of the lungs, and it's usually from some type of inflammation. And rhinorrhea is considered a runny nose. Some diagnostic terms, asthma would be where somebody has obstructive pulmonary disease caused by spasm of the bronchial tubes or by swelling of the mucous membrane. It could be sudden, periodic attacks that usually short of breath and coughing and wheezing, sometimes related to something they're exposed to. Atelectasis is collapse of the alveoli of that lung tissue. Atelol means imperfect, and ectasis means expansion or dilation. Bronchiostasis is abnormal dilation of the bronchi with accumulation of mucus. Bronchitis, inflammation of the bronchi. Bronchiogenic carcinoma is lung cancer. Bronchospasm, spasm of that. Emphysema is referred to as an obstructive pulmonary disease by overexpansion of the alveoli with air and destructive changes in the walls, so the lungs lose the elasticity and decrease the ability to exchange gas. Emphysan means to inflate. COPD is a chronic obstructive pulmonary disease, often brought on by smoking, so chronic bronchitis and emphysema are in that category now as well. Cystic fibrosis is an inherited condition of exocrine gland malfunction causing secretion of abnormally thick, viscous, real thick, sticky mucus that obstructs the passageways within the body, and it affects the lungs. It can affect the GI tract, and then it can get infected, inflamed, and damage the lung tissue. And so children will have it because it's hereditary. They're born with it. And they take medication to try to decrease that thick viscous accumulation. Laryngitis, inflammation of the larynx. Laryngotracheobronchitis, that's a big one. Acute respiratory infection, and it's going to involve just what it says there, the larynx, the trachea, and the bronchi with the inflammation. So laryngotracheobronch, so all those three things, and then itis, inflammation. Laryngospasm, that would be spasm of the laryngeal muscles. Pleural effusion is going to be accumulation of fluid in the pleural cavity, and then pleuritis will be inflammation of the pleura, often called pleurisy. Pneumoconiosis is a chronic restrictive pulmonary disease from prolonged inhalation of fine dust, coal, asbestos, or silicone. And then pneumonia, so we can have several different types of pneumonias. Inflammation of the lung from an infection by bacteria, virus, fungi, or parasite. Chemicals. Pneumothorax is where we get air in the pleural cavity, often by puncture in the lung. We could also have a hemothorax, which also has blood in there. Pneumonitis is inflammation of the lung, usually by a hypersensitivity to chemical or dust. Pulmonary embolism would be a blood clot in the pulmonary system in the lung. Tuberculosis is a communicable disease brought on by the bacilli and the fomites that make up the tuberculin. And here we're referring to it in the lungs, but it could be what we call disseminated, meaning it can go into other organs of the body. Sinusitis, inflammation of the sinuses. Sleep apnea, where somebody has sensation of breathing, usually during sleep or snoring. And tonsillitis, inflammation of the tonsils. And upper respiratory infection, it's going to be involving the nasal passages, pharynx, sneezy, watery eyes, this profuse secretion, common with what you see with a cold. When we look at some tests that we do, ABG is an arterial blood gas. Within that ABG, we're looking at the pH of the blood, so whether it's alkaline or acid, acidity, and the PaCO2, abbreviation for partial pressure of oxygen, and the PaCO2, the carbon dioxide. So it's the most invasive way to measure if you're maintaining adequate breaths. Endoscopy is any exam of the body using a flexible endoscope. So it's a scope to look in to see something. So we often do bronchoscopy, nasopharyngoscopy. So wherever you're going in to look at is going to be your prefix. Auscultation would be where we're using our stethoscope to listen versus audible. You're just using your ears without the aid of a stethoscope. Percussion is tapping the body to elicit vibration and sounds to estimate the size, border, or fluid. So we use our knuckles. Lung biopsy is to remove a small piece of lung tissue to look at the pathology of it under a microscope. And a lung scan would be to use like a CT scan to scan the lungs to detect any abnormalities or decrease of blood flow, any kind of ventilation problem. VQ scan is a ventilation perfusion scan. It's a two-part nuclear med test to detect ventilation perfusion issues. So usually if we suspect that a person might have a blood clot in their lungs, pulmonary embolism will do that. MRI, remember, is non-ionizing images of the lung to visualize any lung lesions. A polysomnography is recording of various aspects of sleep, so like a sleep study. PFT is a pulmonary function test where it measures direct and indirect lung volumes and capacity. Pulse oximetry This is a non-invasive way of, you just put a little measuring device on somebody's finger and you're measuring the percentage of oxygen saturation in the blood. So how well you're being oxygenated. Doesn't tell you what you're being oxygenated with. So if somebody was like exposed to carbon monoxide, which binds with your hemoglobin, it would read that the same as oxygen. Chest x-ray, CXR, taking an image. It could be front to back, anterior posterior, back to front, posterior anterior, or lateral from the side. A CT scan, again, with or without contrast, and pulmonary angiography would be injecting the blood vessels into the lungs with a contrast dye. Some operative terms: adenectomy, so that's going to be remove the adenoid tissue from the nasopharynx. Lobectomy, removal of a lobe of the lung. Nasal polypectomy, removal of nasal polyp. Pneumonectomy, removal of the entire lung. Thoracentesis is a puncture to aspirate fluid out of the chest or pleural cavity. Thoracoplasty is repair of the chest, and usually repairing lungs as well if they're fractured. Thoracoscopy would be using the scope to view inside the pleural cavity. And then thoracostomy, surgical opening of the chest, usually to insert a tube. Thoracotomy is incision into the chest. Tonsillectomy, removal of the tonsils. Tracheostomy, where tracheostomy is an operation to make an opening in the trachea to insert a tube, versus a tracheotomy is just incision into the tube. So that S can make a difference. CPR is giving cardiopulmonary resuscitation and artificial respiration and chest compressions. Now we accentuate chest compressions versus the breathing. CPAP stands for continuous positive airway pressure, where we use a device that has a mask that will deliver breaths into that patient's airway, and typically it's over the nose and mouth. So if they have sleep apnea, they wear one. Endotracheal intubation is where we pass a tube into the trachea via down the mouth or nose to open the airway for delivering the gas exchange. And so it's often going to be, it would be connected to a mechanical ventilation, which is a machine that breathes for them. Or you can, what we say, bag them, use a bag and squeeze it and deliver oxygen. Incentive spirometry is a breathing therapy we use post-operatively after a patient has surgery to get them to take deep breaths in and out. And then that mechanical ventilation, those are ventilators that's going to breathe for somebody, which we're hearing about right now. Some medications, antibiotics are going to help with infection, halt it or stop it from producing. Anticoagulants are going to thin the blood, especially if you have a pulmonary embolism. Antihistamine is going to help neutralize or inhibit the effects of histamine. So if somebody's having an asthmatic attack or reaction, and a bronchodilator is going to dilate the muscle walls of the bronchi. Expirant is going to increase bronchial secretions and promote somebody to cough them up. So if they're congested, we will give the expirants to break it up and make it thinner and make it easier to come out. Bronchiostasis, so you can see here, the picture on the left is normal, coming down. Well, if the patient's the left is bad, but if you're looking at it, the left is good. And then you can see where the fluid or mucus is trapped inside the bronchi or the bronchioles. This one will show you how it gets narrow, so the cross section, and then on the right, you can see where you have spasms, edema, and mucus where you can't exchange air. This is a picture of a pneumothorax. So basically it's a collapsed lung. Air gets in that pleural area, which it shouldn't be. You need to maintain negative pressure to keep that lung inflated. And you can see as the air goes in, if the air doesn't come out, it can push on the heart, and what we refer to as a tension pneumothorax, and it's putting tension on that heart. This Pleurovac is what we would set up to reintroduce negative pressure so that lung can reinflate. So as a nurse, our job is to maintain this. The physician puts in a tube in the chest, and then we connect this, and then we maintain it to make sure that person has it, to maintain negative pressure so it doesn't deflate again. Bronchoscopy, so they're going to go down with a scope. You can see they go down to the trachea, go down to the bronchi, and then they can even go down into the certain areas of the bronchiole, depends on how narrow. They can remove any kind of foreign body or a mucus plug. So sometimes with the children or developmentally delayed person, they might have aspirated on something. When we say aspirate, instead of swallowing, going down to your esophagus into your stomach, when you aspirate, it goes into your trachea and down into your lungs. So when you say, oh, I swallowed down the wrong pipe, this is what aspiration means. So this just kind of gives you breathing by the test subject causes the piston like bell to rise and fall, moving the pan on the recording drum. So it's kind of like a pulmonary function test, and they're going to measure how that exchange of air is. So if somebody is able to maintain certain conditions. So often before this is a spirometry, before like going under anesthesia, they might want to measure that. Pleural effusion, this is where that lung has the fluid in it. And this is something that the lung isn't collapsed. This is in the pleural cavity. And then we would do a thoracentesis to put a needle in and drain out the fluid like this picture. So they're just going to put a needle through the ribs there and then drain that. And then the patient just gets a Band-Aid and then they come back. This is the pulse oximeter that's going to measure the oxygenation of your blood. You can get little small ones like at Walmart for $30 too. If people have chronic conditions, they measure at home. Is normal alveoli here. There's this fibrotic tissue around it, and then you can see the narrowing of the emphysema, how the air is trapped in there, and the alveoli will collapse or they can't exchange. If it's narrow, it's not going to exchange our O2 and CO2. Tracheostomy, if somebody has an endotracheal tube, breathing for them, it can only do that for so long because it'll cause damage to the larynx and pharynx. So then they have to have a trach, or if there's some kind of obstruction that they can't get through the mouth or nose, they will have a tracheostomy to maintain their breaths, as well as you've seen it like on the TV where from smoking, they could have oral cancer and remove parts of their mouth. And so now they have to have a tracheostomy to breathe. There's a CPAP machine, a continuous positive pressure, where they will sleep with that if they have sleep apnea. There's a mechanical ventilator. Again, they have to have an airway to hook that up to. So this on the left, she has an endotracheal tube, and it could be also hooked up to a tracheostomy. So that's it for chapter 10, respiratory.